Welcome back. We continue our conversation with U.S. Senator Tammy Baldwin. We turn now to health care. Several developments in the Obamacare issue. The president and the Republican Party, their leaders, formally asking the courts to strike down Obamacare. They call it unconstitutional. If it were to be stricken down, what would that do to the 20 million people who had?
If it were struck down tomorrow, they would lose their health care. And everybody who has any sort of pre-existing health condition would lose the protection they have today to be offered health insurance that doesn't discriminate on the basis of pre-existing health conditions. But I have to say that, you know, after it passed, there was a court challenge of the Affordable Care Act, otherwise known as Obamacare, that went all the way up to the Supreme Court, and the Supreme Court declared it constitutional. The idea that these years later that they would succeed is, you know, it just takes my breath away that they're trying it again. But the idea that the President of the United States would order his Department of Justice and his Attorney General to not defend a U.S. law, but instead to go into court and ask the court to reject it, to strike it down, with the result of those sort of damaging outcomes for Americans is horrifying to me. And it's one of the reasons I'm in town is to talk with people who have pre-existing health conditions who would be impacted very dramatically should the Affordable Care Act be overturned by the court. And raising the level of awareness that the threat against the Affordable Care Act is still very present and unfolding in many ways. You know, probably half the population of Wisconsin has some sort of pre-existing health condition. So this has a massive impact. But also, the Affordable Care Act helped us make headway in terms of providing coverage for people who previously didn't have access to it. And I think that we really need to be working together, not in a partisan way, but in a bipartisan way, to fix what's broken with the Affordable Care Act, because it's not perfect. It needs to be continually improved, as we do with other programs, and to further extend access to health care coverage and affordability of health care per se, including prescription drugs.
You're a big supporter of protections for people with pre-existing conditions because of a childhood experience.
Absolutely.
What was that? What happened in your life?
Well, I was raised by my maternal grandparents. And when I was 9, I had an illness akin to spinal meningitis. That wasn't the exact diagnosis, but very similar in terms of severity and symptoms. And I ended up being in the hospital for 3 months. Now, unbeknownst to me, because I was just fighting to get better, my grandparents learned that their family health insurance didn't cover grandchildren. And my mother didn't have insurance. So, you know, they write it, it's immediate family, and grandchildren aren't considered immediate family. So I don't know exactly what happened, again, because I was 9 and in the hospital and fighting for my life. But I learned much later that when they tried to remedy the situation after the fact and get me insurance where there was no question that I was insured, I was a child with a pre-existing condition then. And my grandparents couldn't find insurance at any price. And so I went a lot of my life without, a lot of my young life, without health insurance until I got to college and had a group plan option, and then mostly have had employer-provided insurance as an adult. But I felt that was wrong when I learned about it. I felt that no parent or grandparent or foster parent should have to worry. And it's interesting for me to meet how many, you know, countless people across this state who had that anxiety lifted when we passed the Affordable Care Act. Today, and in my travels around the state, I've been meeting with just those sort of families who talk about how they might have had to declare bankruptcy to take care of a loved one, but for having this insurance. and how it worries them to think that in the future it might not be there. So here in Green Bay, I met with a young woman named Grace. She's 15 years old, and she has type 1 diabetes. And she's had that diagnosis since she was 2.5 years old. Her insulin and her the equipment that she needs to monitor her her glucose levels, $1,500 a month. Now, she also is pointing out that her insulin costs go up all the time, but she needs insurance. That's not something that when she becomes an adult and is taking care of herself that she's going to be able to afford at the beginning of a career. We have to fight to keep these protections.
You mentioned the cost of those drugs. You're big on transparency for
Yes.
pharmaceutical corporations and drug prices. You're behind the Fair Drug Pricing Act.
Yes.
What is that all about?
Well, it's a bill that I actually crafted with John McCain before he passed away. We introduced it as a bipartisan bill, and you know, we had both heard so much from our constituents about how, with no explanation, medications that they rely on, in some cases to remain alive, but in other cases, you know, treatment of a condition, or that they kept seeing the price raise or get higher and higher with no change in the underlying medication. So it wasn't like it was new and improved.
Right.
A woman, Diane from Wisconsin, with MS would tell me about her MS medication. Now, it didn't cure the disease. It basically slowed the progression of her symptoms of MS. She'd been taking it for years, and her insurance fully covered it. But when she switched insurance, she had a bigger copay, and she actually looked into how much that drug had increased in cost in the 23 years she had taken it. And it went from $10,000 a year to $90,000 a year. But it was the same drug. I think we need transparency because they ought to justify that. There's no justification that I can see in ninefold increase in the cost of something that hasn't otherwise changed.
Possible for people to
So
afford.
the bill that I drafted with Senator McCain demands that any company that wants to increase the price has to justify by showing what they're spending on R&D, what they're spending on manufacturing the drug, maybe what they're spending on promotion of the drug.
Which is where a lot of the money goes. Yes. We will continue with Senator Tammy Baldwin right after this, so please stay with us.